The New South Wales government has announced tougher COVID restrictions across Greater Sydney. There were 111 new locally acquired cases and the state has recorded another death. Our reporter Cayman Gock is in Sydney and joins us now. So Cayman, we've seen these cases have jumped back up to triple figures. Just break down these numbers for us.
Well, Fauzi, as you mentioned, 111 cases. That's the second highest number that we've seen since this outbreak began. And sadly, as you said, a man in his 80s from southwest Sydney has passed away from COVID-19. The concerning thing for the state government is the number of people infectious in the community. There were 29 people throughout their entire time infectious in the community and another 10 that were in the community for part of the time while infectious. Now, they're the numbers that are stubborn, that aren't going down, and they're the numbers that we need to see plummet if we want to get out of this lockdown. What we have also seen is that 80% of today's cases come from southwest Sydney. This is the main cluster which is causing problems for the state government. And of the 111, 60 of them were from Fairfield alone. So that's the main concern. We also learnt today that there are 75 cases in hospital right now, including 18 people in ICU, and of that, 6 of them are on ventilators. Fauzia?
Now, Cayman, because these numbers are so high, the Premier, Gladys Berejiklian, has decided to impose harsher restrictions, and that is, of course, to drive down these infections. Just go through some of these restrictions for us.
Well, that's the big news today. If you are living in the 3 local government areas of concern in southwest Sydney, that's Canterbury, Bankstown, Liverpool and Fairfield, from midnight tonight, you are now banned from leaving your local government area for work or leisure. The only people who are allowed to leave at the moment are health or emergency workers, so that also includes disability and aged care workers. But if you are leaving the area, you have to undergo surveillance testing, be tested every 3 days, and are not allowed to leave for work if you're showing any symptoms. So that's the big announcement today, where you're not allowed to leave this area, and it's to try and quash the virus. As the Premier Gladys Berejiklian admitted today that we are not seeing that curve go down, and that is the main concern. Outside of these 3 local government areas, though, across Greater Sydney, only critical retail will be allowed to operate. So that includes things like supermarkets and chemists. A list of what is critical and what is not will be provided later today from the state government. And also the big announcement is construction work, large or small, will be put on hold until July 30. So only essential or urgent repairs can undergo during this next fortnight. You're not allowed to work in construction otherwise during the next 2 weeks. And if your boss is trying to pressure or force you to go into work when you're not supposed to, they can now be issued a $10,000 spot fine for doing so. Here's what the Premier had to say a little earlier ago.
We don't know where the virus is lurking. We know where their exposure sites are, but we have a blind spot on the last few days, and we need to make sure that we cover that off. Now, the next decision was a difficult one, a very difficult one. But until July 30, until midnight on July 30, there will be a pause on all construction, large or small.
That's New South Wales Premier there, Gladys Berejiklian. Now, Cayman, the household transmissions are still a major concern for the authorities. What did the Chief Health Officer have to say?
Well, one of the issues is the data that we're seeing has a 5 to 7 day lag. So the issue is, if you were infectious and you may not have known it, you could have infected it to your family, and they may have gone about their day in the community further spreading this virus. But the Chief Health Officer also stated that we're seeing a seeding in workplaces now, which could very well span from someone in your family. And the issue is a lot of cases also seem to be asymptomatic. So you may not know it, but you have the virus. So the Chief Health Officer wants everyone to go about their days as if they could come into contact with the virus at any place, anywhere. Here's what the Chief Health Officer had to say. Take a listen.
I'd just like to reinforce that you don't have to have symptoms to be able to pass on COVID. And in contrast, you're actually very infectious before you have symptoms. And so just because you and your mother are well, don't go and visit your mother unless she needs that care and compassion. If you do need to go there, make sure that you take all the precautions possible and you choose, notwithstanding this very windy day today, outdoor environments, the well-ventilated environments, try and maintain the social distancing, this all needs to be balanced against care and compassion and mental health, and I think that's some of the challenges we deal with in getting those settings right.
Fawzia, this is all, of course, breaking news, and the state government will have more details and clarify about those critical retail later on today. And that also includes regarding the Fairfield and southwest Sydney area where the childcare workers will be able to work or if they're forced to stay home as well.
All right, that's Cayman Gok there reporting for us from Sydney.